My name is Anna Akawola. I'm the medical superintendent in Viola Hospital, which is a 200-bed hospital, and it's the main national referral hospital for Tonga. No one can do this job alone. I have realized that. This is a very big job, and you need the people around you, the people that supports you, to be tip-top and be able to work together so that we can make Viola Hospital a safe hospital to deliver good health. And of course aim for the best outcome that we can get for our patients. Everyone knows that we had some unforeseen incidences last year whereby 7 maternal deaths happened within 8 months or something like that. And it had never happened like this in Tonga. So that's how this chart came about, and we're looking around for, because it's expensive, and we cannot ask the ministry to just give us the money. We have most recently tried to introduce the charts. This is to replace our old TPR chart, it's just temperature, pulse, and respiratory charts that we used to have before when the patients come in sick. With this chart, early warning score, or sometimes we call it early warning sign, because it will identify a patient that is going to deteriorate before she crashes or have a cardiac arrest. We're hoping that if we can use this chart well, we will be able to save a lot of patients by picking up the signs early enough so that doctors or nurses can attend to this patient to intervene before a catastrophe happens. So VSA over the years have been giving us some volunteers. Right now yourself, and I'm so thankful that you're here, Sister Marcel Murphy, used to be a nurse unit manager in ICU in one of the hospitals in New Zealand. And I'm so very thankful because she's helping me a lot with my role, advising on aspects of clinical governance. The clinical governance is what supports the work of the medical superintendent to ensure that we deliver high quality care and safe service to the people of Tonga. So she comes with her experiences from New Zealand and she shares it, and for that I'm very, very grateful to Marcel and also to ESA.
Hi, I'm Marcel Murphy. I'm over here in Tonga as a volunteer for VSA. I've been a nurse since 2000. Worked mostly in ICU in New Zealand and England, and now here. I noticed that education for the nurses after graduation was not something that was happening in a formalised manner. It was happening in service, training was happening, but a formalised education was lacking. And so that's when we talked to Dr. Anna, and VSA agreed, and we went about bringing me on as an educator, a nurse educator. It wasn't long into it that the external review of the maternal deaths situation happened, and it was from that we decided that we needed a escalation pathway, and that's when we made all these forms. And it's been a challenge, but it's been really good, and I'm excited. I'm excited to see how the impact this has on Tonga, especially if we see less deaths and if patients can get to ICU much earlier rather than as a last resort. My work here though, not just with these forms, but also with updating nurses on basic life support, documentation standards, patient assessment. I've really been encouraged by it, and I've really enjoyed being part of it, and I hope to only continue it. I've got another year here, and I look forward to it. It's very different being part of being in a job where you actually feel like you make a difference for a whole country. It's never happened to me before. And certainly being appreciated for people updating, getting their knowledge to international standards rather than just what they've done always since the beginning of time and the like. And even things like we managed to source medication administration books and medication labels that were not being sourced, and little things like that make a big difference with the safety of the patients. So I've found it a really satisfying job, seeing this go out to the outer islands, seeing this being put in place in the in the wards. It's only a small thing, it already happens all over the world, but for Tonga it can make quite a big difference, you know, and that's really exciting to be part of.